Are the pills in your medicine cabinet silently harming your brain? You may be taking medications every day, trusted treatments for pain, insomnia, reflux, or allergies, without knowing they could be increasing your risk of dementia. Shockingly, some of the most commonly prescribed drugs have been linked to long-term cognitive decline, memory loss, and even permanent brain damage, especially in older adults. These aren't obscure or rare prescriptions, they're household names. What's more alarming? Many doctors quietly refuse to take these very medications themselves, fully aware of the dangers they pose to long-term brain health. If that doesn't raise concern, it should. In today's video, we're uncovering the 5 drug categories that have been scientifically linked to a higher risk of dementia, and explaining how they impact your memory and mental clarity over time. Stay with us to the end, you'll learn the safest alternatives to protect your brain before it's too late. Number 1. Proton pump inhibitors, the silent gut-brain saboteurs. Now let's talk about one of the most overlooked threats to your brain health, proton pump inhibitors, or PPIs. These acid-blocking drugs, commonly sold under names like omeprazole, Prilosec, esomeprazole, Nexium, pantoprazole, and lansoprazole, are routinely prescribed for heartburn, acid reflux, and gastroesophageal reflux disease, GERD. Millions take them daily without a second thought. But beneath their reputation for quick relief lies a hidden danger. PPIs reduce stomach acid, which may sound helpful, but that acid plays a crucial role in nutrient absorption and gut health. Over time, these medications can severely deplete vitamin B12 and magnesium, 2 nutrients essential for brain function. Without adequate B12, your nervous system begins to suffer, leading to memory problems, poor concentration, and even permanent nerve damage. And it gets worse. Long-term use of PPIs has been linked to a 44% increased risk of developing dementia, according to a major study published in JAMA Neurology. The mechanism? Chronic use disrupts the gut microbiome, the delicate balance of good bacteria in your digestive tract. When this balance is disturbed, it causes inflammation that can travel through your bloodstream and trigger damage in the brain. This is known as the gut-brain axis, and it's a vital, but often ignored, pathway to cognitive health. In seniors, the risks are even higher. PPIs can also block calcium and iron absorption, increasing the risk of bone fractures, frailty, and anemia. What's more, stopping these drugs suddenly can lead to rebound acid hypersecretion, a condition where acid production surges even higher than before, making you dependent on the medication indefinitely. So what can you do? There are safer alternatives. For many people, simple lifestyle changes, like eating smaller, more frequent meals, avoiding caffeine and alcohol, and cutting out late-night snacks, can significantly reduce reflux symptoms. Some find relief using diluted apple cider vinegar or switching to H2 blockers like famotidine, which may carry fewer long-term risks. Always speak with your doctor before stopping or changing any medication. But if you've been taking PPIs long-term, it's time to have that conversation. Your brain health is too important to ignore. Number 2, benzodiazepines, the anxiety cure that steals your memory. Benzodiazepines, commonly known as benzos, are medications prescribed for anxiety, insomnia, muscle spasms, and even seizures. You might recognize names like Xanax, alprazolam, Valium, diazepam, Ativan, lorazepam, and Klonopin, clonazepam. These drugs work fast and effectively, but their long-term impact on your brain can be devastating. Benzodiazepines enhance the action of GABA, a neurotransmitter that calms the nervous system by slowing brain activity. That's why these drugs are so effective at easing anxiety and helping people sleep. But when taken over time, this very mechanism begins to backfire. Long-term use of benzodiazepines is strongly associated with cognitive dulling, memory impairment, and a significantly increased risk of dementia. Your brain becomes dependent on the drug to function normally, and as tolerance builds, cognitive decline accelerates. One of the most affected regions is the hippocampus, the part of the brain responsible for memory formation. Damage here can lead to permanent difficulty in learning and recalling information. Research has shown that even low-dose use beyond just 3 months can raise the risk of Alzheimer's and other forms of dementia, especially in older adults. And it's not just about memory loss. Benzodiazepines are also linked to increased falls, fractures, and hospitalizations, making them especially dangerous for seniors. And here's the trap: these medications can be highly addictive. Stopping them abruptly can trigger serious withdrawal symptoms, anxiety, insomnia, tremors, and in some cases, seizures. That's why doctors strongly recommend a gradual tapering process under medical supervision if discontinuation is necessary. So what are the alternatives? Cognitive behavioral therapy, CBT, is a gold standard treatment for both anxiety and insomnia. Techniques like guided meditation, deep breathing exercises, and mindfulness training have shown remarkable success in clinical settings. For sleep issues, safer supplements like melatonin or magnesium can be beneficial, and herbal teas like chamomile offer natural calming effects without the neurological risks. If you or a loved one has been using benzodiazepines for more than a few weeks, it's time to reassess. These drugs may offer short-term comfort, but the long-term cost could be your memory, independence, and mental clarity. Don't trade today's relief for tomorrow's regret. Protect your brain. Number 3, statins, cholesterol lowering. But at what cognitive cost? Statins are among the most widely prescribed drugs on the planet, used by millions to lower cholesterol and reduce the risk of heart attack and stroke. Medications like atorvastatin, Lipitor, simvastatin, and rosuvastatin, Crestor, are household names. But while they protect your heart, an urgent question remains: are they harming your brain in the process? Here's what many don't realize: cholesterol isn't just a cardiovascular concern. It plays a vital role in the brain. It supports the structure of neuronal membranes, helps produce neurotransmitters, and is essential for hormone synthesis. Your brain is one of the most cholesterol-rich organs in the body because it needs it. Statins work by blocking an enzyme involved in cholesterol production. But some statins, particularly lipophilic ones like simvastatin and atorvastatin, can cross the blood-brain barrier, where they may interfere with neural cholesterol metabolism, potentially impairing memory, concentration, and learning ability. The research is mixed. Some studies suggest that statins may help reduce the risk of vascular dementia in people with heart disease. But others raise red flags, particularly around cognitive side effects such as mental fog, forgetfulness, and confusion. In fact, the FDA issued warnings in 2012 about memory loss associated with statins. While often short-term and reversible, the frequency of these cases cannot be ignored. There's also a key distinction between statin types. Hydrophilic statins, like pravastatin and rosuvastatin, are less likely to enter the brain and may pose fewer cognitive risks than lipophilic versions. So what should you do if you're on statins? First, don't stop your medication abruptly. For individuals with a history of heart attack, stroke, or severe artery blockage, the benefits may outweigh the risks. But if you're taking statins as a preventive measure, or if you've noticed changes in your memory, it's time to have a serious discussion with your doctor. There are safer, natural strategies to manage cholesterol: a diet high in fiber, omega-3 fatty acids, and plant sterols, regular exercise and weight loss, natural supplements like berberine or red yeast rice, but always under medical supervision. Your heart matters, but so does your mind. Make sure your treatment protects both. Number 4, NSAIDs, pain relief that hurts the brain. Nonsteroidal anti-inflammatory drugs, commonly known as NSAIDs, are staples in medicine cabinets around the world. You've likely taken ibuprofen, Advil, naproxen, Aleve, diclofenac, or indomethacin for headaches, arthritis, joint pain, or inflammation. They're easily accessible, highly effective for short-term relief, and often assumed to be completely safe. But chronic, long-term use of NSAIDs comes with hidden and dangerous consequences for your brain. These medications work by reducing prostaglandins, the chemicals that cause pain and inflammation. However, prostaglandins also play a critical role in maintaining healthy blood vessels and circulation. When these chemicals are suppressed for too long, it compromises blood vessel function, reducing the amount of oxygen-rich blood that reaches your brain. This condition, over time, may increase your risk of cognitive decline and dementia. Furthermore, NSAIDs have been shown to raise blood pressure, increase the risk of stroke, and cause microvascular damage, all of which can impair brain function. And the damage doesn't stop there. Chronic use of NSAIDs also harms your kidneys and stomach lining, leading to ulcers, internal bleeding, and decreased clearance of toxins, all of which add stress to your entire system, including your brain. Among NSAIDs, indomethacin and diclofenac appear to pose greater neurotoxic risks, with some studies linking them to worsened cognitive outcomes compared to other pain relievers. Interestingly, there was once hope that NSAIDs could help protect against Alzheimer's disease, but that benefit only appears to exist when used very early in life, and not once cognitive symptoms have already begun. For seniors and long-term users, the risks clearly outweigh any unproven cognitive benefit. So, what are your safer options for managing chronic pain and inflammation? Consider natural anti-inflammatories like turmeric, curcumin, with black pepper, ginger tea, or omega-3 fatty acids, which reduce inflammation without damaging vital organs. Physical therapy, yoga, and acupuncture can also provide long-lasting relief without neurological risk. Pain may be part of life, but protecting your brain is essential to living well. If you've been relying on NSAIDs regularly, it's time to explore smarter, safer strategies. Talk to your doctor about non-drug alternatives that support both your mobility and your memory. Number 5. Anticholinergics, blocking acetylcholine, blocking memory. Now we come to one of the most concerning, and often overlooked, threats to brain health, anticholinergic medications. These drugs are used to treat everything from allergies and insomnia to depression and bladder control issues. You may not recognize the class, but you'll recognize the names: Benadryl, diphenhydramine, amitriptyline, oxybutynin, scopolamine, and hydroxyzine, among many others. These medications work by blocking acetylcholine, a neurotransmitter that is absolutely critical for memory, learning, and focus. In fact, acetylcholine is the very chemical your brain relies on to form and retrieve memories. When it's blocked repeatedly, especially in older adults, the effects can be profound and lasting. Research shows that regular use of anticholinergics can increase the risk of dementia by up to 50%, with older adults being especially vulnerable. This isn't theoretical. Brain scans of anticholinergic users have shown greater shrinkage, or atrophy, in regions tied to memory and cognition, particularly the hippocampus. Even more alarming is the cumulative effect. Over 600 medications, including many over-the-counter drugs, carry what's called anticholinergic burden. That means even if you're taking low doses of multiple medications, the combined impact on your brain may be far greater than you realize. And the side effects are not limited to long-term memory issues. People using these drugs may also experience blurred vision, dry mouth, constipation, confusion, and even hallucinations, symptoms that are sometimes misdiagnosed as early dementia, leading to unnecessary additional prescriptions. So what are the safer paths? For sleep problems, consider melatonin or valerian root, which promote rest without disrupting brain chemistry. If you're managing bladder issues, bladder retraining, pelvic floor exercises, and newer medications with lower anticholinergic profiles may offer better long-term outcomes. And if you rely on antihistamines, switch to lower-risk options like loratadine, Claritin, or cetirizine, Zyrtec. If you're taking any of these medications regularly, especially if you're over 60, it's time to talk to your doctor. A medication review could protect your memory, your independence, and your future. When it comes to brain health, what you don't know can absolutely hurt you. Stay informed. Stay protected. What to do if you're already taking these drugs? If you're currently taking any of the medications we've discussed, don't panic, but do not stop them suddenly, especially if they include benzodiazepines, anticholinergics, or statins. Abruptly discontinuing these drugs can lead to dangerous side effects, withdrawal symptoms, or serious health consequences. Instead, the first and most important step is to schedule a conversation with your doctor. Ask about a gradual tapering plan if appropriate, and discuss safer alternatives that won't compromise your cognitive health. Your doctor may also recommend regular cognitive assessments to monitor your memory, attention, and overall brain function over time. It's also wise to keep a personal medication review sheet, a simple list of every prescription, over-the-counter drug, and supplement you take. Bring this to every doctor's appointment and update it often. It could be the tool that prevents dangerous drug interactions or long-term neurological harm. Remember, your brain deserves the same level of care as your heart or joints. Stay proactive, stay informed, and always advocate for your long-term health. Medications have the power to heal, but when taken long-term without proper oversight, they can also harm, especially when it comes to brain health. The very drugs meant to relieve your pain, anxiety, reflux, or insomnia may quietly increase your risk of memory loss and dementia over time. That's why staying informed isn't optional, it's essential. Speak to your doctor, review your medications regularly, and don't be afraid to ask about natural, evidence-based alternatives that support both your body and your mind. Because in the end, your brain is your most valuable asset, protect it wisely. Have you been on any of these medications long-term? Comment below if you've experienced memory changes or made a successful switch. Share this video to protect someone you love. Subscribe for more doctor-reviewed health tips every week, because your health deserves clarity, not confusion.